Please mention the chat box. Am I audible? Is my screen visible? So today's topic is special diets, page number 523 in your dietetics textbook. Page 523, dietetics textbook, special diets, chapter 25. Those who have the textbook. If anyone is joining late, please help them out with the page number or topic name. So first special diet is purine restricted diet. Okay. Body usually produces this uric acid. Everyone's body will produce uric acid as a byproduct of a lot of chemical compounds. Okay. And once it metabolizes, when the uric acid metabolizes, it becomes this compound called purine. Okay. And if there is too much of uric acid in the bloodstream, we call that condition as hyperuricemia. Okay. They will produce a lot of purines in their body. Okay, and that could lead to a disease condition called gout. And it's a form of arthritis. Okay, it happens in your joints, gout. Okay, and this hyperuricemia can be, can develop because of a combination of reasons. Either your body is producing too much of uric acid, and when too much of uric acid is produced, usually there is a genetic reason behind it. It runs in your family that the body is producing a lot of uric acid. So there are food that can also trigger the increase in uric acid in your bloodstream. So you have to avoid those foods completely so that you get some relief from this disease. This is gout. Okay, this is how a joint affected with gout looks like. Because this excess of purine, which your body is producing a lot of uric acid. Uric acid gets metabolized into purine, and this excess of purine will go and deposit near your joints, causing inflammation, swelling. Okay, it will restrict the joint movement as well, mobility as well. Okay, so that is gout. So the basic concept here for purine restricted diet is you have to lower the intake of high purine food. Okay, because purines, they break down into uric acid. So reducing the dietary purine can help reduce your uric acid and reduce the flare up, gout flare up, that arthritis flare up. But it's not a medical treatment. It has to go side by side. This diet has to go side by side with medical treatment. Okay, just by going on purine restricted diet will not clear this issue. Okay, it's not a management, it's just a dietary management. So what are the foods that you have to completely avoid? Food that are high in purines. Organ meats like liver, kidney, sweetbreads, that is glands. Okay, the glands of animals. Okay, avoided heart and all. This organ meat has to be, and glandular meat has to be avoided completely. Some fish like anchovies, sardine, mackerel, scallops. Okay, these things you have to avoid. Tuna fish and all you have to limit. Okay, and what you can have properly when it comes to protein, all tofu, soy, nut, butter, whole grain, yogurt, low fat dairy food, eggs. Okay, these you can have. This comes under the protein category. Coming to drinks, anything that has high fructose, corn syrup, the sugary drinks and all, avoid that. Alcohol also, especially when you have a flare up, when you have arthritis, alcohol has to be completely avoided. Limit fruit juices, alcohol, especially beer, any hard liquor, spirits and all. What you can enjoy drinking, not non-fat milk, low-fat milk. Enough hydration should be there, so drink enough water. Unsweetened tea and coffee. And other body habits or lifestyle habits, smoking, you have to quit. Maintain your body weight. Any crash diet or high protein diet you were on, stop that. Okay. Limit your sugar intake, honey, sweeteners, any sugary desserts, salt, too much of salt in the diet. Whole fruits you can have, which is not completely ripe. Okay. Don't have completely ripe fruits. Little bit if it is raw, that's much better. Regular exercise should be done. So these are the patterns you have to follow when it comes to purine restricted diet. A lot of cherries and all you can have. Beans, lentils. Okay. Next is ketogenic diet. The history of ketogenic diet was not for weight loss at all. Okay. Historically, ketogenic therapy, diet therapy was started for children who were suffering from convulsions, fits. Okay. Intractable convulsions, those kids who were suffering from, they were put on this ketogenic diet. Okay. And as a result of that, weight loss was also seen. So, weight loss was kind of a byproduct of ketogenic diet, and it was marketed later, it became a marketing strategy for weight loss, ketogenic diet. But it was started to help kids who have epilepsy, and they are not put on ketogenic diet for their lifetime. Okay, at least for 1 year, 6 months to 1 year, the child will be put on ketogenic diet. Their guardians will be guided on what to give, what not to give. Okay, and slowly we will bring back the child to normal diet. So ketogenic diet is not meant for long term. Okay, even for medical diet therapy purposes, ketogenic diet was not meant for long term. And carbohydrate is severely restricted. The main situation in ketogenic diet is 5%, only 5% of the energy should come from carbohydrates because that is required by your brain for functioning. Okay. Remaining 95% of calories should come from proteins and healthy fats, good fats. Okay. So, irretractable epilepsy had these symptoms. The child will stare into a space, go into convulsion, stiff muscles. And when they are in convulsions, they undergo complete blackout. They don't have any sensory idea of where they are. Okay. Lack of time will be there. They fall. Sometimes they urinate without control. Okay. Defecate without control during the convulsions, biting their tongue. This can happen. So this is the main principle of ketogenic diet. Carbohydrate should be 5 to 10%, not more than that, to keep the brain functioning. Okay, because brain requires glucose to function for energy. Protein 20 to 25%, and remaining comes from healthy fats. Okay. 70 to 80% energy comes from healthy fats. What you have to avoid, all fruits, potatoes, starchy food, beer, rice, bread, sugar. You have to completely avoid it because these all are carbohydrates. How it helps for people who have different conditions, ketogenic diet. For diabetic people, it reduces the blood insulin level because there are not enough carbohydrates to get the insulin up. Okay. To increase in the mitochondria in your cells. When more mitochondria is produced within your cells get more energy.